A runny nose is a common condition where fluid is discharged from the nose. The discharge can vary in consistency and color, from light and clear to thick and greenish yellow. The fluid may drip from the nostrils, flow down the back of the throat, or both. When the fluid flows down the back of the throat, it's known as post-nasal drip. The condition is commonly referred to as rhinorrhea or nasal mucosal inflammation. These terms essentially refer to the same condition but are different ways of describing it. Rhinorrhea typically refers to light, clear discharge from the nose, while nasal mucosal inflammation causes swelling and inflammation inside the nose. Rhinorrhea. This is a general term for a runny nose, often associated with light and clear fluid. Nasal mucosal inflammation. This refers to inflammation and swelling inside the nose, often caused by infections or allergies, leading to increased nasal discharge. Causes of runny nose. A runny nose can be caused by many factors, including infections, allergies, or irritants. The most common causes include infections, common cold. One of the most frequent causes of a runny nose caused by viruses infecting the upper respiratory system. Flu, another viral infection that can lead to a runny nose, along with other symptoms such as fever and fatigue. Sinusitis, or sinus infection, is when the sinuses become inflamed, and it can lead to nasal congestion and a runny nose due to mucus buildup. Respiratory syncytial virus, or RSV, is a virus that causes upper respiratory infections and can lead to a runny nose. Allergies are another common cause of a runny nose, and they're often triggered by allergens such as dust, pollen, and pet dander. When exposed to these allergens, the body releases chemicals like histamine, which causes inflammation in the nose and results in a runny nose. Non-allergic rhinitis, sometimes called vasomotor rhinitis, is a condition that causes a runny nose without any known external trigger. It's thought to be due to abnormal reactions in the nervous system, which lead to the widening of blood vessels in the nose and increased mucus production. Environmental factors like dry or cold air can also irritate the inside of the nose, causing nasal membranes to produce more fluid. So people living in cold or dry climates may notice an increase in nasal discharge during these times. Polyps or foreign objects can be another reason for a runny nose. For example, a foreign object, like a small toy stuck in the nose, can cause a runny nose, often just on one side. Nasal polyps, which are benign growths, can also contribute to this condition. Hormonal changes, especially during pregnancy, may lead to a runny nose as well, because these changes can cause swelling of the nasal tissues and increased mucus production. And, some medications can cause a runny nose as a side effect, such as those used to treat high blood pressure, depression, erectile dysfunction, or seizures. So, symptoms of a runny nose can really vary depending on what's causing it. Common symptoms include nasal discharge, which is fluid from the nose that can range from clear to yellow or green. There's also nasal congestion, meaning a blocked nose that might make it tough to breathe. You might notice a headache, especially if sinusitis is involved. Facial pain can show up too, usually around the nose and eyes, and that's often due to sinus inflammation. And of course, coughing can happen because mucus drains down the back of the throat. This post-nasal drip is a pretty common trigger for a cough. So there are certain situations that really do warrant medical attention. You should consult a doctor if your symptoms persist for more than 10 days or if you develop a high fever. If the nasal discharge turns yellow or green and it's accompanied by facial pain or fever, that could indicate a bacterial infection. Also, if you notice blood in the nasal discharge, or if the runny nose continues after a head injury, it's definitely time to seek medical advice. For infants, you should seek medical attention if your baby is under 2 months old and has a fever. And if the runny nose or congestion is causing problems with breastfeeding or breathing, it's important to contact your child's doctor. There are, some simple steps you can take to help alleviate symptoms before you visit a doctor. First, try to avoid triggers, so stay away from allergens like dust or pet dander that set off your symptoms. Over-the-counter antihistamines can be helpful too, especially if you're dealing with sneezing, itching, or watery eyes because of allergies. For infants, you can use a saline solution to drop into one nostril, and then gently suction the nose with a soft rubber bulb syringe. And don't forget to stay hydrated. Drinking plenty of water helps thin out the mucus and prevents dryness. Saline sprays or nasal irrigation solutions can also help clear out nasal passages. And, it's a good idea to avoid irritants like cigarette smoke or sudden changes in humidity. By following these steps, you can really reduce the symptoms of a runny nose and make yourself more comfortable until you're able to see a doctor for appropriate treatment.